Family medicine in Illinois is evolving, and staying informed has never been more important.
Welcome to the Illinois Pulse, Family Medicine Insights, a podcast from the Illinois Academy of Family Physicians.
Each episode features conversations with physician leaders, public health experts, and advocates shaping care across our state.
From clinical updates to advocacy, wellness, and real-world practice challenges, we focus on what matters most to Illinois family physicians.
With new topics each month and voices from across the profession,
listen and stay connected to the pulse of family medicine in Illinois.
Hello, family physicians, and welcome to our very first podcast episode of the Illinois Pulse, Family Medicine Insight. My name is Mustafa Alavi, a family physician and first vice president to the Illinois Academy of Family Physicians.
And I'm Christina Wells, family physician and second vice president to the Illinois Academy of Family Physicians. We're excited to host this podcast series to our Illinois physician members, and we hope to bring you all some exciting and relevant topics.
So our first topic is the Family Medicine Advocacy Summit. So Christina and I had the joy of recently going, and we thought it would be great to share some of the highlights from such an amazing conference. And I'm coming back with so much energy and momentum and just really excited to be engaged politically. And to kick this very first episode off, we have a very special guest from the American Academy of Family Physicians, David Tully, Vice President of Government Relations at FAAFP.
Thank you guys for having me. It's an honor to be with you all.
Thank you and welcome, David. Why don't you tell us a little bit more about the Family Medicine Advocacy Summit? Like, what's the purpose of it and what happens during the summit?
Sure. Well, again, thank you for the opportunity, and it's an honor to be part of the kickoff to this series. So let me start first talking a little bit about what the purpose is of the summit, and then I'll talk a little bit about kind of what the typical family physician will experience when they come to Washington, D.C. So there are kind of two purposes that come to mind for me. The first is the summit is a great opportunity to create a direct connection between family physicians across the country and lawmakers that are in positions making policy that impact family medicine and primary care. And it's in this experience that family physicians are able to talk a little bit more about what's happening in the real world, what they're experiencing as practicing doctors, what they're seeing in the exam room, and how that can be translated into developing sound public policy that hopefully will improve the healthcare for all Americans. The second purpose for me really is to demonstrate to policymakers what collective strength looks like in family medicine. And this is something I talk a lot about with members as I travel the country and go to a lot of our major convenings, that there's truthfully a power in numbers. And when we think about the collective membership of our academy, especially our family physician friends in Illinois, when we can bring everybody together for a couple of days and have them go to Capitol Hill and talk about the things that are impacting them, there is a real power behind those numbers. This year, we had more than 350 family physicians come from 46 states, including the District of Columbia. And that was a historic number of attendance in the entire history of the Advocacy Summit. To your other question, Dr. Wells, about what a family physician could expect when they come to DC, we really look to create an experience to not only empower you for the engagement you're going to have on Capitol Hill on the second day of the fly-in, but we also try to set you up to be a confident and empowered advocate after you leave Washington, D.C., and you bring your advocacy back home. So what that looks like is a series of workshops, usually right after family physicians arrive in DC. We usually spend what I call like a day in the classroom. So we have a number of different sessions that are catered to beginner advocates, seasoned advocates, and we really try to make sure everybody feels a level of comfort before they go to Capitol Hill. And then the second day, which is really what I like to call our Super Bowl, is when we all get together and we leave the hotel and we go to the Capitol and we spread out and we visit with our lawmakers. And this year, the 350 family physicians that were in DC attended more than 240 Hill visits on Capitol Hill, which is a remarkable number of meetings and engagement with staff. And so that's kind of really the purpose. And that hopefully will provide some, kind of inside baseball perspective, what it looks like for a family physician if they come to DC.
Yeah, I know that, you mentioned some things, David, about being united and and really energizing people. As every time I come to these summits, I always feel like I leave with a renewed sense of who I am as a family physician and how I can advocate for myself and for my patients um, that I take care of every day. So it really, really, really is an exciting time.
It is. And I'm going to crib this from one of my fellow colleagues that I worked with back in commission year a couple years ago, Dr. Renee Cricklow from Massachusetts, who's been an advocate who's come to our summit every year. Dr. Cricklow talks a lot about how advocacy is really a great way to alleviate or prevent physician burnout. And we hear burnout a lot in the conversations that we have with family physicians across the country. And so I could think of no better way to push back against that burnout than to come and impart the wisdom of your experience on those who are making critical policy decisions that not only impact you as the physician, but the patients that you're caring for.
I think that hits it on the spot. I came out of the conference so energized, and yeah, it's a change from the day-to-day struggles we go through as physicians, trying to advocate for our patients and for ourselves. And it's so uniting to share that with other family docs and know that we're making a difference by speaking to our legislators who are here to listen to us. And one thing I really took away from that session was that none of us as physicians are politicians, but we're not expected to be politicians. And I came out of the conference, I learned how to advocate. I learned what was top of mind in policy and politics, and I learned how to be more effective when I speak to my legislators. And I hope to take back some of those skills here in Illinois.
Absolutely. And I think the skills translate. And I think this is what makes family physicians so unique when you look at all the different specialties out there. The one thing that really excites me about family medicine, you all are advocates every day in the work that you do. Whether it's advocating for that patient that needs a certain therapeutic, right? Whether it's, pushing back against a prior authorization request that's being issued by a payer, whether it's if you're in an employed setting and you're trying to see certain policies being implemented at the health system level, family physicians are advocates in the work that they do every day. And that even goes beyond the exam room. It goes into their communities, it goes into their family and friends networks. And so many of the skills that family physicians deploy every day and the advocacy of their patients and the practices they work in translate very much to the work that we're doing in DC and the work that you all are doing back in Illinois. The one thing I tell members all the time is that it's one thing for someone like me with 18 plus years of government relations experience to go to Capitol Hill and to go through a series of talking points and data points and explain an issue. It's another thing when a family physician can come in and go, here is the issue, and let me talk about what that looks like in application. And I think we talk a lot about this at the summit of the power of storytelling, where family physicians are in a unique position to take so many of the experiences you have every day and the conversations you have with your patients and put that in a story that actually puts a face on the policy. And so I love the energy that you bring for it. That gives me energy. And I will tell you that kind of seeing everybody leave on Tuesday, I had a lot of energy coming out of that, and our staff in DC had a lot of energy and just the excitement of the collective number of family physicians that came together.
I feel that energy, like you said, and I really enjoy being able to tell those patient stories. And I think for the people that we engage and talk with, really helping them to understand what our patients are experiencing on a day-to-day basis can really, really be helpful. And so I know each year I've been to this summit several years in a row, but each year we talk about different bills that we're advocating for. And so this year there were three new bills. And so can we talk a little bit about what those bills were and how they relate to patient care?
Yeah, I'd be happy to talk a little bit about the bills. And I know a common question that comes up is how do we decide on the bills that we have members focusing on? So I would love to take a few minutes and kind of talk through that process and kind of bring you all in behind the scenes of our work. So each year we try to take an intentional effort to identify three topics, recognizing that The typical meeting is about 30 minutes in length. Sometimes it's a little bit less. And we also try to identify three issues from kind of three major focus areas of our work. So, one of the focus areas is the value of primary care. We think about making sure that physicians are paid or reimbursed appropriately for the services that are rendered to patients. We hear a lot from our membership about just the constant growth of burdens on practice and that burnout that is we see as a result of that. And so we typically try to have an ask that falls into what I call the administrative burden bucket. And then lastly, we try to have a workforce topic to talk about because we recognize that workforce is what translates to access, what links to patient outcomes and affordability. And so, we try to find a way to bring workforce into the conversation because we really truly need to make concrete investments on our family physician and primary care workforce if we truly want to improve our nation's healthcare system. So this year we focused in on three policies that we've been working on now for several years and are kind of coming to fruition. And one of them is a little bit more of an urgent one as a result of some administrative changes. But I'll talk a little bit first about the chronic care management bill. We know that 60% plus Americans have at least one chronic condition. I think 40% have more than one chronic condition. And we know that family physicians are at the epicenter of this and are more involved than ever in that longitudinal delivery of care. But we also know at the same time that there is a series of codes that are not being utilized to recognize the complexity of delivering chronic care management. And so we've been working very closely with a bipartisan group of lawmakers to get the Chronic Care Management Improvements Act introduced. And that would essentially waive the coinsurance, right, or the patient financial responsibility associated with the utilization of these chronic care management codes. Because one of the things that we heard is that the financial barriers are inhibiting the utilization of these chronic care management codes. Medicare Advantage, we hear a lot about Medicare Advantage these days. It now represents more than 50% of the Medicare beneficiary population. A lot of people would argue that there's some really solid enhancements with Medicare Advantage, but there's also a series of problems with Medicare Advantage. And we hear a lot about things like prior authorization and utilization management that make it harder for patients to deliver care, but also for those patients to receive that care and to get the timely care. And so we have been working very closely with policymakers to get what's called the Medicare Advantage Improvements Act introduced. And that would put in place a number of reforms around things like prior authorization, but would also put transparency mechanisms in place so that clinicians who deliver the care, as well as patients, know exactly what insurance companies are doing in their decision making around what is considered approved care or not approved care. And the last issue, kind of when I think about that workforce bucket, was really thinking about the important role of our international medical graduates. More than 20% of our membership are IMGs, and I think nearly 30% of our nation's healthcare system is made up of IMGs. And they are such an important part of our system, especially when we look at it from family medicine. They are practicing in communities across this country where sometimes there isn't any primary care or there are other specialties that are unwilling to practice. And what we've seen over the last year is a series of missteps by the administration to crack down on those who are coming here who want to continue their medical training and want to make a difference into the delivery of care. And one of the very troubling policy changes that was made last summer in 2025 was creating a new application fee for those who apply for H-1B visas. And the price tag is so astronomical that most systems could never afford to pay it. It's $100,000. And so we've been working with a bipartisan group of lawmakers to get the H-1B for Physicians and Healthcare Workforce Act introduced. And what that bill would do is it would waive the $100,000 application fee for medical professionals who are pursuing an H-1B degree. So those are really the three issues that we landed on. And I want to take a moment and talk about how we get to that point. How do we decide that these are the issues that we're going to have family physicians talk about? I would say the first thing we look at is we look at the environment. We look at the policy landscape, the political landscape. We also take what's happening sort of at the national level, kind of outside of Congress, and that kind of gets intertwined in it. and we try to identify what are the most important policy issues that are very relevant in the current debate. We hear a lot about the need to manage chronic care. We've heard that from this administration, we've heard it from Congress, we've heard it through the MAHA movement. And so that's why we felt it was important to lean in on getting this cost sharing addressed with the chronic care management codes. We also try to look at areas where there's bipartisan support. And in all the bills that I've listed, each of those bills has secured both Republican and Democratic support. And in a two-party system, what we've discovered is that if you want to get good public policy through Congress and enacted by the president, you generally need to have both parties at the table. And so we generally try to identify those bills that have some consensus from both sides of the aisle. And then the last thing is where we see there are opportunities to move the needle on certain reforms. And this is hard because there's so many issues out there. And because the AFP membership is so diverse and our policy is so diverse, it's hard to lock in on three subjects. But a lot of times we hear directly from policymakers that they need our help in helping move a piece of legislation forward. Like the H-1B bill is a great example of that. We heard directly from the authors of the bill, as well as some of our colleagues across the House of Medicine, that we needed to get more co-sponsors on that bill. And so it made sense with 350 family physicians in town to get everybody to kind of unite around that bill and the other bills that I described. But we also recognize that other issues come up in these visits. And I talked a little bit about this during the summit that, if the subject of vaccines comes up or the subject of maternal health comes up or Medicaid, we invite family physicians to share their story. So back to the storytelling, Dr. Wells, that, if there was a specific story that someone had on one of those issues and it came up in a conversation, we invite family physicians to go into those conversations and come in as an informed educator to those policymakers.
Great. Thank you so much for that high level overview. And I really appreciate how you phrased that last section about how you chose the three topics, because like you're right, as a family physician, every single healthcare topic is important to us and our patients. And it's hard, I imagine it's really hard to choose, but these are three bills that I viewed it as this is the right moment to get 300 plus family physicians, politically speaking, to have conversations, to get a bill past the finish line. And it's not that other issues are not important. Like for me, working at an FQHC, I'm thinking about Medicaid work restrictions and ACA subsidies going away that really impact my patients. And it's not that those issues are not important. It's that those issues are still important. And we have different avenues to advocate for that. But in that moment, when we were all there in DC, these were the three top of mind bills that needed that extra energy behind it. So thank you for that reframing.
You actually hit on something that if we can take a second, the different avenues of advocacy. And I think that's a really important point, because I think and I think this is just kind of normal. It's not just our society. I think other medical societies have this issue. If they don't see something happening or us acting on something, sometimes there's an assumption we're not working on it. And one of the things I've said to members multiple times is we have a number of different tactics that we deploy for every issue. Every issue is not treated the same, and every issue has a different level of severity. But one thing I want your listeners to know is that we are fighting for family physicians on a wide range of issues. And even though those issues may have not risen to the level of focus during the summit, I want your listeners to know that we are fighting for those other issues, whether it's pushing back against the very harmful Medicaid cuts that have taken effect, whether it's going after the gold standard of the physician-patient relationship, or the attack on student loans and a number of the different programs that have existed to make medical school more affordable. We are working through a number of different channels to pursue reforms on this. And I want family physicians to know that there's a lot of different ways we can get involved. And I think we're going to get there at another point in our conversation. So I'll pause there. So at that point.
Yeah, no, thank you again, David, for this very comprehensive overview. We can definitely see that AFP is at the forefront of advocacy. And to your point, my next question was going to be, how can a family physician become more involved in advocacy?
Absolutely. It's a great question. When I joined the Academy 5 years ago, in addition to the number of the enhancements that I brought to the team in terms of how we approach advocacy, one of the things that was really important for me personally was how do we give family physicians a voice in our process? And I like to think of our family physicians as an extension of our team. And I don't like to think that I speak at them, but I think it's more how do we work in tandem and work in parallel? So there's a couple different ways that family physicians can get involved. The first is we have this great new program called the Advocacy Ambassador Program. We actually started this program in 2025. And I have to be honest with you, at the time, we had some very conservative estimates for how many members we thought we were going to participate. I think at the time we thought we were going to hit roughly 200. We actually crossed the 1,000 mark last week. We have 1,000 family physicians who have decided that they want to join us in this journey of trying to effectuate meaningful policy change. And so I encourage your members, your listeners to join our program. The nice thing about the program is that we meet you where you are in your journey, whether it's as little as sending a grassroots alert to your member or it's coming to Washington, D.C. We want advocacy to be meaningful to you. And if it's a lot or it's a little, we don't care. We just want you involved. I mentioned our Speak Out program. This is what I call the lowest hanging fruit of advocacy. We develop a number of pre-populated communications that you can send to your lawmakers on a wide range of different issues. And with so many things that have happened in the healthcare landscape over the last year and a half, we've made a concerted effort to make more Speak Outs available, recognizing that our members are really frustrated with what's happening in Washington, D.C., and we want to give them a seat at the table to lend their voice. Registering to vote is really important. We have a partnership with Vote ER, and it's intended to create opportunities for you to have conversations with your patients about, registering to vote. And so I encourage you to go to the AFP website if you want to learn more about the Vote ER partnership. And then lastly, we talked about FMAS a lot, but I can't emphasize enough the importance of local advocacy back at home. I think everybody thinks you have to go to Washington, D.C. to make meaningful policy change. And I would argue there's a lot of important things that are happening in the state of Illinois right now. I know you all have had a lot of stuff around scope of practice and, mid levels and where they are in a team based care setting. And there's a wide range of other issues, obviously, you're working on. But local advocacy days are just as important, if not more important. And so I think for those who are listening to this podcast who are new to advocacy, you don't have to come to Washington, D.C. to make a difference. You can show up in Springfield, Illinois and make a huge difference. And so I encourage you to think about ways to get more involved in your chapter and engage in local advocacy.
Great. And what's next politically speaking? I know the midterms are coming up. What should we plug ourselves into?
Great question. So 3 things that come to mind. So I talked a little bit about the ambassador program. We are rolling out, this is the kind of first time we're rolling it out under the Advocacy Ambassador umbrella, an August recess campaign. We actually kicked it off last night with a call with about 50 or 60 family physicians. And we talked a lot about the importance of engaging with lawmakers while they're back home during the month of August. What a lot of people don't know is that lawmakers leave Washington, D.C. for the whole month of August and they go home. And a lot of people think that they go on vacation, but they actually do more than that. They actually visit medical practices. They go to chambers of commerce. They hold town hall meetings. And so we spent some time last night talking with our members about why they need to engage with their lawmakers back at home. Later this month, we're going to have a call. In fact, I'm going to make a plug for it. July 29th, which is a Wednesday at 8 p.m. Eastern. We are inviting family physicians to join us for a conversation around policy subjects that we want them to focus on during the month of August. And we are hoping by that point, a number of family physicians have made the commitment to either send a speak out to their lawmaker, record a video message to their lawmaker, or actually set up a meeting while their lawmaker is back at home. So that's the one thing that's in the near term for us. I'm thinking a lot about what the end of the legislative year looks like. And believe it or not, we only have somewhere between 30 to 40 legislative days left in the actual calendar year, which is not a lot of time. And we still have a lot of policy we have to get across the finish line. So our team is thinking through what are the areas that we need to lean in on from an advocacy standpoint, especially on those policies that we want to get across the finish line. And some of the issues that we talked about as part of this podcast are very much part of those conversations. And the last thing I'll say, and you brought up the midterms, I'm thinking a lot about 2027. It's never too early to start thinking about what is the message that we're going to bring to the next Congress. I think we first have to start with kind of sort of reintroducing family medicine. And I say that because there's usually a significant level of turnover with lawmakers and staff with a new Congress. So we have to reintroduce family medicine every 2 years. And then after that, I think we have to look at what coverage policies we want to address. What do we want to do to strengthen and increase the size of our family physician workforce? What do we need to do in terms of improving the healthcare for all Americans? And then lastly, what do we have to do to make sure that family physicians feel satisfied in the work that they're doing? And how do we reduce those burdens? So our team is starting to think about what types of policy solutions we want to push forward. And as an extension of that, I'm also thinking about 2028 and what we need to be doing and starting to influence the conversations that are happening amongst the presidential candidates. So a long-winded way of saying a lot of things coming on the horizons, and our team is very much vested both in the near term and long term of our advocacy efforts.
And I do want to say that that could sound overwhelming, the amount of things coming up. And I'm looking at the Speak Out website. There are so many things we could speak out about. And we're just saying, have a conversation with your legislator during the month of August, because they look to us as family physicians, as experts in healthcare topics, and they're doing their own research. They're looking to soundboard ideas off of us too. Like, we met with our representatives, we met with Jan Schakowsky's office, and they were asking us about AI and how that plays into prior authorizations and many denials, and they are looking for what we are experiencing on the ground. So even if there aren't too many topics you want to talk about, natural conversations, getting your foot in the door, showing them that you're a family physician that is passionate and has things to discuss will keep the conversation going and show the value we bring as family physicians.
Absolutely. And I think there's one last point I would make is that advocacy is about building trust. And even if, and you made this point, I think it's a good point, even if you don't go into a meeting over the August recess and talk about our 3 policy subjects, even if you're just introducing yourself as someone that can lean on you for advice and direction on healthcare policy, that to me is as much of a win as getting someone to co-sponsor a bill. Because at the end of the day, we want that trust. We want policymakers to know that family physicians are a trusted and reliable source of information that can be very helpful in effectuating good policy. So I completely agree with you. It's very straightforward to set up a meeting. Also, you can just walk into the district office and introduce yourself and ask for a few minutes. But I definitely think thinking about how to offer yourself as a resource is a really great way of building trust.
Yeah, thank you so much. I think this conversation has continued to energize me and wanting to be an advocate for my patients and to really reach out to my local legislators. And so, David, again, we want to thank you for joining us tonight. I know you mentioned that there is something going on July the 29th. Can you repeat that again for our listeners, and also where they can go to get more information?
Absolutely. I'll start with where to go. So if you go to AFP.org, if you go to our advocacy dropdown, there's more information on our website about our August recess campaign. And on July 29th, which is, I believe, a Wednesday night around 8 p.m. Eastern time, we are going to bring several members of our team here in Washington, D.C., to talk to family physicians about the topics we think family physicians need to talk with their lawmakers about over the month of August. We're currently working actually to push out some communications to our chapter leaders as well. So that's another way to surface this information. But we want to open this up even beyond the advocacy ambassadors. We want first-time advocates who have never touched advocacy in their life to come and join us and be part of this. We want you to be part of this journey. And so we hope that we will get a great turnout on July 29th, especially as we get ready for our August recess campaign.
Yeah, well, thank you again so much, David, for joining us tonight. Thank you for all that you do to represent the family physicians across the nation in terms of advocacy. And so we really appreciate you taking your time to educate us and our members about ways that they themselves also can get engaged in advocacy.
Well, thank you for the work you guys do every day. And thank you for approaching me at FMAS about this opportunity. You guys literally came right up to me and asked, and I'm honored to be able to be part of this. So thank you for the invitation and good luck to you.
Thank you.
So that was a great interview from David Tully with the AAFP. I wanted to segue and go into a little bit more detail about one of the 3 bills, the H-1B for Physicians and Healthcare Workforce Act bill. and how that affects us as physicians. So I'm a medical director at a federally qualified health center, and I know this is impacting how we recruit physicians. I know we're having conversations on how are we going to afford $100,000 to sponsor an H-1B visa. That's just not possible for us as an FQHC. And we will have less of a workforce because of it. So I'm also honored here to have Dr. Amro ElSharoud, a family physician, and have him share his experience with the H-1B visa process. Amro, do you want to tell us more about yourself? Where are you practicing? And
Mustafa, thank you so much. And Christina, good to have both of you starting and kicking off this wonderful podcast. So my story in a nutshell, I'm from Egypt. I grew up in Egypt. I attended medical school in Egypt before moving to the United States for my medical training. I completed my family medicine residency at Texas Tech University Hospital in Lubbock, Texas, and then came back to Illinois because I saw an opportunity to make a meaningful impact in a community. But truly and truthfully, it's where my wife is at and where I met her when I came first to the United States. And I fell in love with this state and with the city of Chicago, particularly. But today I practice a full spectrum family medicine with surgical obstetrics. I work in city of Galesburg, Illinois, in Knox County, and I work with OSF and St. Mary Medical Center. I see patients for all ages in the clinic. I do prenatal care. I deliver babies, perform C-sections, continue caring for families along from deliveries and afterwards. I thankfully and gracefully grateful to see all the babies that I get to deliver and see them growing. I've been here for about 3 years, and I'm very grateful for all the experience that I've had here. So yeah, that's kind of a nutshell where I come from and my background.
So Amro, I understand you are an H-1B visa recipient before this bill and the restrictions before. So can you tell us more about that process?
Yes, I am, and I am a recipient of an H-1B visa, or sometimes it's called the J waiver. I'm still currently on an H-1B visa where I practice. And to explain that in a simple way that avoid all the complexities that includes in how getting it, because it is complex even for the people who have it. When I came first to the United States, I am on something called J waiver. This is a special visa for the people who come to train. And in order to stay in the United States to practice medicine after residency, we switched from a J1 visa to an H1B visa to waive the rule of going back to my home country for 2 years, hence receiving an H1B visa. I received my H1B visa in 2023. That is after my graduation. And that was before the new rules that has been applied early in 2025 of $100,000. Sometimes it's said each year, or for an H-1B visa physician, or any H-1B, but now it's impacting physician, and it would have impacted someone like myself, and currently impacting a lot of physicians who are finishing their residencies and going into the workforce as an H-1B visa physicians.
Yeah, and you shared some stories about some of your colleagues going through this experience now. Can you tell me more about what that process is looking like now?
Yeah, absolutely. So the process in general is a very complex, is very stressful. After residency, many international medical grads do not really choose only where they practice, but instead they navigate this very complex immigration requirement, trying to find positions that both fit our career goals, but also meet all the visa regulation, multiple steps, including employers, attorneys, always government agencies, strict timelines, lots of delay, and any small delay can create a lot of uncertainty. And even after securing a position, you still keep ongoing immigration consideration that continue for years afterward that I am still living in and dealing with. I was lucky with my employer. They were very supportive, and they have helped me through support from attorneys to get through this and continuing getting the support. But currently, two of my best friends who I am very, very close with graduating. They just graduated like a week ago, and both are going into two rural communities, both in Maine and in Wisconsin, secured positions, and they were supposed to starting date. One of them was July 1st. The other one is coming up next week. And both of them are on hold right now. Their employers told them, well, we don't know what's going on. Maybe you need to stay in the country. We will try to work it in the country. Please do not travel. And some of them have not seen their families for a year. One of them had a child and wished to go back to see his family and for the baby to see their grandparents. The other one hasn't seen his parents for 3 years. And they wanted to go to visit their families, but now they are afraid to leave the country. And they're living in this uncertainty, not able to leave, but also um, have not started their jobs yet. And they, up until today, are still dealing with that. I'm hoping things will move forward with them. I'm very confident that they will work it out. The amount of uncertainty that they are dealing with on a daily basis when I speak to them is tremendously stressful and unnecessary in every way.
Oh my God, I can't even imagine that, the amount of stress that this must bring, especially as you graduate, hoping to start a job. And we're talking about family physicians meeting the need of access to healthcare, especially in rural areas. Amro, you are what a family physician, like the dream family physician. You're doing full scope, you're doing surgical OB. And if you graduated 2 years later, it sounds like you would not be able to do the job you do now, or would be incredibly delayed and be
Yes.
living in a very anxiety provoking period of not knowing if you could work. And
True.
and this is happening across the country because of one specific rule of $100,000, a fee that no organization can really just foot the bill for. This is so prohibitive to patient care and also supporting physician access and physicians looking to come here to the United States and to stay here and improve our communities.
Yeah. Like, I'm in conversation with our medical director and their hiring process as part of my job right now in the leadership role. And we talk about this like almost every day. It's incredibly stressful. They're worried about the prospect of hiring and maintaining position in the community. And you know what? I just like to throw some stats out there. The vast majority of physicians who start working in rural areas, which tend to be heavily um, um, staffed, and physicians who are on visa or immigrated, or they were on visa at some point, within 6 years, 80% of them stay in those communities. I mean, those are communities that are struggling, and that is exactly the type of physician in all specialties, but definitely in primary care, who you want to hire, that will stay in the community because they build a life here after they move into the arms of a new community that welcomes them. So there is a lot of loss that's definitely happening in many aspects and all over the country.
Exactly. And I am so grateful for what you do at Amro. Thank you for moving to Illinois. We need more family physicians like you, and we need to support this bill specifically. We need to get rid of this $100,000 fee for H-1B visa. So any family physician listening, anyone listening, like, talk to your representative about how bad this bill is to the health of our communities and the lives of physicians like Amro.
Well, thank you so much, Mustafa.
Yeah, thank you for being here, and keep doing what you're doing. We'll fight to keep you here.
So it's been really interesting to, hear the experiences of our family medicine physicians. And, my experience with the Family Medicine Advocacy Summit has always been really great. Each year, I really enjoy going to really learn about hot topics that are being advocated for in Congress, and also just to be energized by um, being around and a meeting and talking with fellow family physicians from around the nation, being united on specific things that we're advocating for, but bringing our unique voices that are driven by the communities that we serve. So we really sat down and talked with staffers who were really interested in the experiences of family medicine physicians on a day-to-day basis and how this landscape of a lot of different things that are going on around the country are impacting our ability to take care of our patients. And it's really those conversations that are most impactful, those conversations where we're sitting in the congressperson's offices and really talking to those staffers and really helping them to understand what our day-to-day experiences are like. So for me, that is the richness of my experience at Family Medicine Advocacy Summit, and I enjoy going every year.
Yeah, and I share all those same sentiments. This was my first year going as an attending. I went as a medical student many, many years ago, where some of these bills didn't totally make sense to me. And this year it like really clicked for me. I got to meet family physicians in so many different practice settings, and we all share the same, um, I'll say, struggles and things that we need to advocate about. And then when we did get in with our representative and our staffers, it was honestly, it was just very conversational. Like we are, at least for my district, we were very much in line in terms of our goals in terms of the bills. Jan Schakowsky's office, their staffer asked us some good questions, as I mentioned, about like AI and healthcare and how is AI being used for prior authorization. So like it's actually was really great to hear that they're trying to get ahead of it and make sure we're not seeing AI driven prior authorization denials, and that they want to hear from us as family physicians. It wasn't on the agenda for us to talk about, but that's where our conversations ended. That was just really inspirational. And for me, fills a bucket of advocacy that I don't get from my day-to-day job of being a physician or an administrator. And it just brought a lot of joy to me. And I can't wait to go again next year. So thank you for joining us for this episode of the Illinois Pulse Family Medicine Insights. And a special thank you to David Tully with the American Academy of Family Physicians and Dr. Amro ElSharoud for sharing their perspective on Family Medicine Advocacy Summit and Amro's experience with the H-1B bill in specific.
Yeah, Dr. Alavi, this was a very good conversation. And for our listeners, we hope that this was helpful in your daily practice. We love to hear from you. So send us your feedback or suggestions for future topics to education@iafp.com. Thank you for listening.